In this media, you will learn about how we breathe. We all know that we inhale and exhale air through our nostrils, and then the air reaches our lungs. To understand the mechanism of breathing, it is important to learn the anatomy of lungs. Let us observe the structure of our lungs. You can see that our lungs are placed in the chest cavity. The windpipe connects the nasal cavity to the lungs and helps in the passage of air. The lungs are well protected by the rib cage, which surrounds the lungs on sides. You can see that the diaphragm, a large muscular sheet, forms the base of the chest cavity. The rib cage and the diaphragm play an important role in the mechanism of breathing. Let us understand the mechanism of breathing. We inhale air through our nostrils. This air then passes to the lungs with the help of the windpipe. Breathing involves the movement of rib muscles and diaphragm. During inhalation, rib muscles move up and expand outwards, while the diaphragm moves downwards. This combined movement of rib muscles and diaphragm increases space in the chest cavity and allows airflow. During exhalation, rib muscles move down and contract inwards, while the diaphragm comes to its normal position. This contraction of rib muscles and movement of diaphragm results in the reduction of space in the chest cavity, and thus air is pushed out of the lungs. If you keep your hand on your abdomen for a few seconds, you can feel the movement happening during inhalation and exhalation. The air that we inhale has many unwanted components like smoke, dust particles, pollen, grains, etc. Sometimes while breathing, some particles get stuck in the hair follicles of your nose. These cause irritation in the nose and result in sneezing. Smoking damages lungs and may also cause cancer, hence, we should not smoke. Thus, you have learned about how we breathe. Human respiratory tract consists of nose, mouth, pharynx, larynx, and trachea. Followed by these organs, trachea has carina. The trachea is further separated into upper and lower lobar bronchus at both left and right side. This is another view of morphology of respiratory tract. The trachea, left lung, pulmonary blood vessels, and heart are the visible parts. The lungs consist of right, left, upper, middle, and lower lobes.